Hi, I'm Dr. Andrea Krause. I am a professor of pediatrics, a pediatrician working through Norton Children's Medical Group with the University of Louisville School of Medicine, and I am the past chair of the Kentucky Eating Disorder Council for the last 2 years. I know I have to keep this brief because you're running low on time. There's some facts there about the Kentucky Eating Disorder Council that are included in the packet. And some just general facts about eating disorders in Kentucky. A few specific things to talk about regarding eating disorders. It is the second highest mortality rate for any psychiatric illness, only overshadowed by substance use disorder. I think you all are probably aware of those facts from our work with the council in the past. It is a debilitating diagnosis that can kind of occur over the course of 10 years. It can be chronic and relapsing. It's a very costly diagnosis, estimated to cost $64.7 billion annually in the nation. And then, definitely there's an under-recognition of those who have eating disorders. Likely only 20% are actually captured and treated for the illness. And it does require a very multidisciplinary team, dietitians, physicians, counselors, therapists of a variety of types in order to get someone into recovery. So the reason I have an interest in it is because this is my patient population. I treat pediatric patients with eating disorders that are hospitalized at Norton Children's Hospital. So the bill that we have proposed is regarding body mass index, and just a quick primer on that is just a quick calculation. It's really not that fancy. It's a ratio of your weight to your height. That's all it is. And so it does not take into account factors such as your skeletal mass, if you have like a large skeletal frame, for example, or if you have a high muscle mass. It can kind of alter the BMI and make it maybe higher than it appears. And then it is commonly used as a marker for wellness. And this can be the case whether this is obesity medicine that we're talking about or in the treatment of eating disorders. And I think it can be a real barrier when you're approaching illness like that. And so with the House bill that was proposed back in the early part of the year and now BR 467, we would basically ask to have health plans cover eating disorders irregardless of like the BMI. So would not allow them to limit coverage just based on this type of a measurement, the BMI or ideal body weight, or any other kind of like weight-based measurement. And that basically promotes the use of behavioral approaches to the illness, because those are better indicators for how sick someone is with an eating disorder. That's whatever their eating behaviors might be with the illness, how much supervision is required in order to get them better, labs, vital signs, those are better markers of illness. And then there's always co-occurring illnesses, anxiety, OCD, depression, and a variety of things, suicidality especially. So why we think this is necessary is because BMI use, it is estimated that 90% of people with eating disorders have actually a normal body mass index. And if some specific examples I have here are males, like males with eating disorders generally have kind of a normal BMI. And so looking at that number alone really doesn't give you the full picture. Atypical anorexia nervosa is an illness entity that is rising, and I'm seeing that in the hospital. People that come in with very normal body mass index. So, whenever you do the calculation, it looks pretty normal, yet they have lost a striking amount of weight. And actually they can be just as sick as someone, who has a BMI of, 10 when a normal BMI for, say, a female is like 22. But their vital signs can look just as bad. So, things to consider. I think this is helpful. This kind of legislation is helpful to try to lay the groundwork. In the state of Kentucky, we have a lot of limitations when it comes to treatment of eating disorders. And so I think this is one area that just kind of like lays the groundwork for better access to treatment and care. We got a nice intro, so I don't have to go into the details of this about the Kentucky Benchmark Plan, the fiscal impact report. I personally have the fiscal impact report here, although she showed it on the screen from March that included the hearing coverage as well. So it was stated that it was an immaterial impact. And so in the interest of time, I will leave room for
Thank you.
Representative Fleming.
Well, she did a lot of the ramp up for me, which was really good. But in a summary, Mr. Chairman and members of the committee, we did propose a bill last year, and I appreciate working with the chairman going through that process. All we want to do basically is to not only have the BMI in there, but also mental health. This is a mental health issue as well as a BMI. My understanding is that that the exclusion of of eating disorders have been taken out of the plan, which basically goes you into a default mechanism or default process in terms of this is a mental health issue, and that's covered under the plan because they've identified mental health in the plan and so forth. And in order to do that, so what we like to do with this bill is just to codify, just to make it clear that when we go through and look at the coverage, that the BMI and mental health, which is an underlying main issue, I believe, is basically covered from insurance. That's all I have, Mr. Chairman.